Good afternoon, everyone, and welcome to today's session, Orthopedics. Let us see who is going to heal that fracture, plaster the wound, and say that you are a champion in the subject of orthopedics. I'm still waiting. Almost we have 23 players online. It's very easy to get the link to play the quiz. Just you use this link, which is the WhatsApp joining code. You're able to see the code, right? So this code, this link, if you click now, you will end up in our WhatsApp group. So once you are inside the WhatsApp group, we will keep posting you the quiz link, right? Only one time you need to do to become part of our conglomerate. Once you do it for one time, next the series of quizzes, you need not worry. The quiz link become posted in that WhatsApp group, right? So I can see 22 online, and I'm still waiting to touch this number 30 to have a stiff competition, right? So please inform your classmates and drop a line that the 30,000 rupees, 40,000 rupees in stake, who is going to be the winner? And every day night, 9 p.m., Dr. Harita is going to give you a 20-question rapid-fire challenge in pathology across the year, every day, 9 p.m., 20 questions with Dr. Harita. I'm trying to find all the 19 teachers like that, so that every day you have 19 quizzes like this to charge your preparation almost every hourly, so that you are on that high spirits of competition and to compete with others. So let us make the great beginning, Doctor. I think we have almost 22 online, which is a good quorum for us to begin the quiz. Yes. Good. Let us start. Question number 1, orthopedics. Which part of the shoulder joint capsule is weakest? Boom, boom, boom. Punch your answer. Which part of the shoulder joint capsule is weakest? Excellent. We have 31 online players. So happy. Please invite your other friends also. That's good. It is the inferior part of the shoulder which is weakest. That's great. Dak is on the top, followed by Harry and Kamineni. Wonderful. Now, question 2. In the rotator cuff, typically the most commonly damaged muscle in the rotator cuff injuries, which is that most commonly damaged of all the muscles. Boom, boom, boom. Right. The most commonly damaged is it supraspinatus or subcapsularis? I believe it should be option A is the correct answer. Just a small error in the key. Yeah. So the next question. Lift-off test is done to assess the strength of which muscle? Lift-off test. Lift-off test. Yes, it is subscapularis. This is the correct answer. Earlier one, the most commonly injured is supraspinatus, not subscapularis. But for this is the correct answer. Lift-off test is done to assess the strength of the subscapularis is what you need to remember. Manasvi, very nice to see you, but I want to see you in the game. Okay, just please go to this WhatsApp link, WhatsApp joining link, and get the quiz link. Okay, so please join the quiz. Good. Good to see 32 online. So that keeps JD on the top. So lift-off test is also called Gerber's test. It is basically to look for the strength of the subscapularis muscle and to identify the rupture of the tendon of the subscapularis muscle is what you need to remember. Now, Sachs lesion is a defect in which aspect of the humeral head? Very, very grilling, minute point. Yes. Absolutely right. So you should be clear on posterolateral or anterolateral what exactly is the hill sac. That makes JD to be on the top. Very good. Now, question 5. What is false about reverse hill sac? Reverse hill sac. A interesting question, huh? So, reverse hill sac. Great. It is the posterior dislocation of the shoulder where the medial part of the humeral head, anterior part of the humeral head, anteromedial part of the humeral head is the one which is affected, which is called reverse hill Sachs, but it is posterior dislocation is what you need to remember. Good, good. Carminelli is little clean bold, but otherwise we have amphetamine, Bunty, Priya, Harsha. Come on, Harsha is today keeping a low profile. Anusha, Joshua, Avijit, and many more. Good, good, good. See, one advantage with this quizzes is if you are part of our WhatsApp group of the online MBBS quizzes, we will post the quiz link beforehand. Even if you are there in hospital, in the ward, with your girlfriend on a boat, swimming across the English Channel, doesn't matter. Anywhere in the world you are, you can still be able to join on your smartphone. Okay, so that is a great advantage. So please be part of our WhatsApp group so that you get the update. Now, Doctor, reverse hill sac is seen in the posterior dislocation of the shoulder. Very good. Question 6. What is the normal orientation of the humeral head? Is it retroverted or antiverted? How many degrees? Grilling question, huh? Grilling question. But still, most of you wrongly answered as antiversion of 15 degrees, but it is retroversion of 30 degrees. That's the point of interest. Now, that keeps Harry on the top. Question number 7. In the anterior dislocation of the shoulder, you see all these things except, yes, punch your answer. Anterior dislocation. Great. You see increased vertical circumference. Hamilton ruler is positive. Dugas is positive. They're all true about anterior dislocation. Once more, doctor, I want to tell you, we have a quick revision program in orthopedics coming up shortly. We have an excellent teacher, Dr. Ravikiran Sir. In about 15 hours, he is going to give you an end-to-end revision of most of the common high yield points that you need to master. And this orthopedic session of 15 hours is going to cost you 2,000 rupees. So in order to get a entry into this live program, which will be conducted more like a webinar, right? So not on the YouTube freely. You can be able to call our helpline to get your subscription. Okay, so please call 900-868-3562 to join the live interactive rapid revision in 15 hours with Dr. Ravikiran sir. Okay, so yes. Now, question number 8. Inferior dislocation of the shoulder. What is the nerve injured? Very standard MCQ. Let us see how much you are ready with the ortho. Beautiful. Axillary nerve. Axillary nerve. That keeps Harry harping the top. So now, question number 9. What is wrong about shoulder dislocation? Do you think anterior is more common than posterior? In posterior dislocation, do you see a fixed lateral rotation? Is contracture maneuver is effective in anterior dislocation? What is false? Option B is false. So anterior dislocation is more common than posterior. Posterior only occur whenever there is any patient with epilepsy, or if you give electroconvulsive therapy, all that muscular jerking will lead to posterior dislocation. Otherwise, anterior is more common. And contracture is effective in anterior dislocation is what you need to remember. So that keeps Harry on the top. So what you see is a fixed medial rotation in case of the posterior dislocation. That's what you're going to remember. See, doctor, when you listen a lecture, you won't remember, but you are challenged, then that stimulates you to do wrong, and that stimulates you to read and remember. That too with a beautiful competition with your 32 friends across India. I want this to be more viral. Now I'm approaching all the medical college principals, almost 700 medical colleges. I'm writing to them. Please give a chance for all your students to come and participate in our rapid fire quiz sessions that happen across the day, the quiz tournaments, and we give 40,000 rupees worth of onlinembbs.com video library as a compliment to the students who are the winners. So we are getting good response. So shortly in future, we are going to have 3,000, 4,000 students competing for our quiz tournaments. Now, question number 10. Monteggia fracture. What is the common nerve involved? Yes. Monteggia fracture. Brillianto. Posterior interosseous nerve is the common nerve involved in the Monteggia. Very few of you correctly answered. That keeps Harry Avatar Kaminini racing for the top. 11. Anterior interosseous nerve. It is injured in what situation? Anterior interosseous nerve. Yes. Very good. In the workman's ischemic contracture, anterior interosseous nerve is injured. Very good, Harry. Now, Question number 12. Lunate dislocation. It leads to injury to which nerve? So, questions look simple, but you need to have revision perfection. Absolutely. Lunate dislocation lead to injury to the radial nerve. So anatomical snuff box, radial nerve, you should remember. Question 13. Which is the ossification center which is first to appear of all this? Around the elbow. So this is another purely biscuit question. Absolutely. Capitulum is the one. Very good. That keeps Harry and Kamineni racing fast. Question number 14. So, is it non-union or malunion or both of them, which will lead to varus deformity? Yes, absolutely right. Malunion around elbow lead to varus. Wow, Kamineni, Al-Kaminaini is on the top. Excellent. So malunion around the elbow causes varus, cubitus, varus. Non-union around the elbow causes valgus, cubitus, valgus. Please don't forget this basic clinical aphorism in orthopedics. Next question is challenging. What is a wrong statement among these? Does supracondylar fracture humerus causes malunion? This is a very interesting question. Oh, only 6 of you. Oh, only 9 of you. Very good. Correctly answered. So, there are certain important principles. Al-Kaminaini, you are from which part of the world? Yes. So, supracondylar fracture causes malunion, hence cubitus varus. And this fracture is above the growth plate, hence it is a static cubitus varus. Now, non-union virtually is unknown in case of supracondylar fracture humerus. That is the reason cubitus valgus is not seen as a complication of this fracture. Please don't forget this very important principle. The lateral condylar fracture of the humerus is known for non-union, and it involves the growth plate. That's the reason it leads to a cubitus valgus, which is a progressively worsening cubitus valgus. Whereas the supracondylar fractures lesion is static in nature. So the lateral condylar fracture of the humerus rarely undergoes malunion, but in the lateral condylar fracture of humerus, cubitus valgus is much more common compared to that of the varus. That is a small paradox. Gotcha? So please don't forget and be part of our WhatsApp study group and request for the PDF of these questions and the explanations. Question number 16. Oh, all of you are going to win this. So if you have done this wrong, doctor, please remember, high time you start orthopedics. There are 40 hours of revision content in onlinembbs.com video library. Please call our helpline and get an access. Extension type, I told that 21 majority correctly answered. See, such a wonderful future toppers are part of our daily quiz playing group. Al Khamenei is on the top. Yes, 17. The most common type of distal fragment displacement in supracondylar humerus fracture. What type of displacement you see in the distal fragment? Another discrete question routinely asked in the NEET PG exam. Posterior-medial displacement with internal rotation. That's what you need to remember. Very good. Most of you did wrong, but SR, Sairam, have done it correctly. Excellent, Sairam. So, question number 18. The most common cause of volkmann's ischemic contracture. Tomorrow, when examiner puts a sniper on your temple and a knife on your jugular, you should give the correct response and grab your seat. Fractured supracondylar humerus. Beautiful. Very good. So, doctor, evening 7 p.m., we are going to have a breathtaking, a real breathtaking quiz on pharmacology. Are you ready for a fight? Yes, sir. And also bring all your friends. I want to see all of you fighting, all of us fighting together for the 40,000 rupees top prize. Every day, unless we give 3 to 4 students a free subscription as a prize to be in the top position in the tournament, almost worth of almost 1,60,000 to 2 lakhs worth of prize, we don't feel like going to sleep. So that is the reason. Tell your friends, आओ खेलो पैसे कमाओ और अच्छा ज्ञान भी कमाओ by getting the subscription to onlinembbs.com video library, mock test, everything, right? And every day 9 p.m. you have pathology with Dr. Harita. She's going to give you very challenging questions and sharpen your saw for the pathology. Now, question number 19. The most common fracture associated with vascular injury. Which one? The most common fracture associated with vascular injury. Boom, boom, boom. Hey, that's right. Fracture supracondylar humerus brachial artery is the one which most often is involved. That keeps Al Khamenei on the top. So please remember some most commons about supracondylar fracture humerus. The most common fracture with vascular injury. The most common cause of volkmann's ischemia. The most important thing that happens is non-union with supracondylar fracture. 20. The most common elbow dislocation. Anterior or posterior? Come on, who is going to give me correct answer? Whoa! That's right. Posterior. That is great. The most common dislocation of the elbow is posterior or posterolateral, and usually it is a fall with the forearm supinated and the elbow either extended or partially flexed with the forearm supinated. That is what is the underlying cause for the elbow dislocation, which is most often posterior, just like hip. Only shoulder is anterior. 21. Cubitus varus. What is the preferred treatment of cubitus varus? Wow! Lateral closing wedge osteotomy is considered to be the preferred treatment. Great. Al-Khamenei is rocking in ortho. 22. If the head of the radius is removed, what will it result? Lengthening of the limb, valgus deformity, varus deformity, no deformity. Come on. Super. Valgus deformity if the head of the radius is being removed. That's awesome. Last two questions going to decide the topper. Open reduction is not required in which fracture? Beautiful question. Very beautiful. Come on. Great. Outer 1/3 of the radial head. Open reduction is not required. Excellent. Al-Khamenei. Last question to decide who gets 40,000 rupees. In the fracture of olecranon, excision of the proximal fragment is indicated in all the scenarios, except for this you might have read orthopedics thoroughly. 9 of you have correctly answered. Any old ununited fracture, non-articular fractures, elderly patients, excision of the proximal fragment is very much indicated. Whoa! That keeps Al-Khamenei. Zindabad. Al-Khamenei. Very good, very good, very good. So Al-Khamenei, please take a snap of the screenshot and send it to our helpline, and you get an instant activation of 40,000 rupees worth of onlinemmbbs.com video library with 3,000 video lectures, 30,000 MCQs, Q scanner, 65 full-scale grad tests and discussions, and 1 lakh PowerPoint slides of notes. What else is required for you to give us one day good news that Al-Khamenei is the NEET PG topper one day? Yeah, thank you so much. And thanks to all of you. And please don't forget, evening 7 p.m, bring all your friends. Pura khandan ko lana. सब मिलके खेलेंगे, मजे में पढ़ाई करेंगे और एक दिन नीट पीजी में टॉप रैंकर बन के दुनिया को दिखाएंगे कि हम वो सिकंदर हैं जो जीत गया नीट पीजी को. Right? That's the deal. And after 7 p.m, 9 p.m, you have pathology with Dr. Harita. Okay, so that is great. Have a wonderful evening with a English tea and restart your preparation. Keep reading, keep reading, keep reading. That's the only secret to become the topper. Deal? Thank you.